Good morning. Thanks for hosting this. I'm Tina Buat from MIR, and I have a question regarding one of the goals. The fifth goal you stated was privacy and security from CMS. What is Cal eConnect or CHHS role in working with Cal OHI to develop privacy and security standards so that we don't go right or left or backwards?
Yeah. Cal OHI has been our lead in terms of developing the privacy and security pieces, and we have the Privacy Committee and Security Committee that have been working with Cal PSAP. So as you know, in the governor's budget in May, the official Cal PSAP Privacy and Security Advisory Board was eliminated. However, it did identify that that work should continue with leadership from Cal OHI, and in particular the privacy and security committees that had been in place and the work groups that had already been in place. So that work has continued, and Cal OHI is continuing to lead that activity. One of the things that we're really trying to explore right now are what are some of the mechanisms in terms of how we address issues that everybody's identified around law harmonization in particular, and what are the things that we need to do to reconcile both California law with the federal initiatives, especially as we watch some of the federal initiatives. They're changing some of the rules on us as we go. So there's this balancing act between how to do the reconciliation and yet how not to be too far ahead of what the new rules are that they're going to set, so that we keep everything in sync. So we're looking at some mechanisms for how to do that. One of the pieces that we're looking at is how to then be able to leverage the outreach of Cal eConnect to be able to do both education, outreach, and hearing what the issues are to help compile that, understand it, so that both the work of Cal OHI, the privacy and security teams, committees can then work together so that we address those issues, because we know that those are some of the underlying issues in terms of exchange throughout the state, is really focusing in on that law harmonization, and it's one of the areas that's called out in the grant as something that we need to be doing. So doing that and getting those things ready to go so it can move into the legislative processes and those kinds of things and be debated in those arenas is one of the activities that we'll be doing over the next year and continuing. I mean, really it's building off of the work that's been done, because this is an area that California really dedicated a lot of resources to before high-tech, and then high-tech came and sort of spurred it along in a slightly different context, and so we've been renormalizing, I think, to that environment, and those are the next steps. So, yeah. There's another question over there.
I'm going to add to that. So the role of Cal eConnect is to be the champion for health information exchange in California. So part of our job is to provide the expertise that then feeds into this process in multiple ways. So, you know, while Cal OHI has the administrative lead, Cal eConnect is really stepping up and saying, here's what we know about health information exchange, and here's what we know is and isn't working, so that we can just make that work, so that we can communicate it.
I think there was yep, and then, okay, so
Thank you.
In the red shirt, and then we'll move forward.
Good. Thank you for both of your presentations, but especially for your amazing leadership in both roles. I realize that you have chosen foster care and long-term care as two focused priorities, but given the other goals that you have for involving the patient and the family and moving beyond the doctor's office, how would an asthma coalition from Fresno, the second most polluted city in the world, come to whom to become a pilot? This is the ability to send promotores into homes to see triggers. Is that through your office, or?
So the work that you've heard about today is really got many different components. One of the things we didn't necessarily go through in more detail this morning was especially some of the work that's going on the public health side. We do have a booth here from the California Department of Public Health, and there's a session specifically this afternoon. One of the things that we're working on there with our public health programs is around some of that outreach, and we have a large component around asthma management within public health as well. So it's coordinating all those different components, and even though we've highlighted the foster children long-term care as part of that breakthrough goal, that's not the only thing we're working on, obviously. So again, the overall reach of the grant is to look at how do we create HIE happen in the state, and coordinate these different efforts, recognizing that each community may have different priorities. And so the key is how do we not redo? How do we connect? So we'll look forward to hearing more from you specifically to see where those connections need to occur. So please look for us later. There's a over there.
Hi, I really appreciated your comments today. I'm a pediatrician and is very passionate about foster children. And I'm just curious how the interaction with what's happening from the state in realignment will affect your wonderful goal.
Well, obviously, as the Undersecretary mentioned, there's a lot of realignment work going on. And we're, the mental health, a number of the other services are working through that. These are long-term targets. We recognize throughout state government, we also have a HIE Policy and Coordination Committee within the Health and Human Service Agency in particular to coordinate the state government impacts, but are also working very closely with the California Technology Agency to work with other parts of state government because there's huge areas there in terms of adoption of EHR, whether it's at the local level or the state level, how those things interact, how we're doing care. So we're on that pathway. I have no significant answers other than we very much have energy and commitment to working in partnership with the different stakeholders, both in government and outside of government, to help advance these projects and to try to work on that transformation. It's going to be a slow process, but it's on its way. Yeah.
Good morning. I understand the need to push HIE before 2014. However, you chose two breakthrough areas, foster care and long-term care, two components that are on the human services side of the house. How do you plan on reaching across and involving them in this process?
So, I mean, the question is sort of to phrase it maybe in another way that I hear you asking is, one of the aspects of high tech is that it's very focused on healthcare. And yet there's, and this is one of the reasons for identifying those populations as well, so much of health happens outside of healthcare. And it happens in our human services, it happens in our community services, it happens in our family structures, in our environments, in the way that the roads are built, the transportation, et cetera. So there's so much that impacts health outside of health care, which includes, as you mentioned, the human services. So one of the aspects that has been raised by many folks about the HITECH Act is that it includes incentive payments for providers, hospitals, critical access hospitals. It leaves out social behavioral, it leaves out public health, it leaves out labs, it leaves out pharmacies, it leaves out long-term care facilities, it leaves out, so in other words, it leaves out quite a few areas that obviously are critical to the care of patients. So one of the goals of the HIE Cooperative Agreement Program has been trying to help identify those, working with federal partners, recognizing, and the federal side has recognized that there is that gap. We're not likely to see a lot of new money coming that direction per se, but there's still a lot we can do to work together to identify opportunities to leverage our existing resources. And I think that's some of what we're seeing, and part of the reason for raising the conversation is to ask that question. So what are the opportunities? We know we are providing human services. We know we're providing health services. How do we start to join those together so we provide them both more efficiently? And what are those opportunities? In scarce resources, we have to look at things in a new way. And that's one of the challenges I think that we have. And we look forward to hearing great ideas from you all too.
Hi, Lynette. Marie Harder, SEIU Local 1000, Vice Chair for Unit 1. So, of course, I'm going to throw in a little union help here, is that I'd like to piggyback on what this gentleman was talking about. And, you know, I know that there's no incentive out there for this kind of coordination with the care, but we have a lot of people that have worked in exactly these fields, we have AFSCME, which represents many of our local counties in the Medi-Cal provision for foster care. We have many retirees from the state and counties that have worked in CPS and many of the other programs. With the state, we have many lab techs and pharmacy techs, and I think that there's a lot of resources there and available that even though there's no incentive programs available, there are some really excellent resources that could be used in this area.
Mm-hmm. Thank you. Yeah, and that's part of, I think, the energy that you heard from Laura. Is one of the roles that we really see Cali Connect playing is helping to bring together many of these folks that are working in these different areas. And part of, one of the things I mentioned is the High Tech Act is one set of funding. California really has made huge commitments that go well beyond high tech. And that are really working on this transformation. So one of the roles that Cali Connect will be playing is helping to coordinate those different pieces and bring folks together. And again, it's more than just high tech. So although we focused on that somewhat today in terms of recognizing those pieces, there's more than that. And absolutely, there's a tremendous amount of knowledge, understanding, experience that really can provide some interesting solutions, I think, that are being piloted now and that are being thought of and worked on and will continue to emerge. We've sort of joked that 6 months of time in this environment is more like normal 10 years of change. So the way things look now compared to 6 months ago has just been really transformative, and we appreciate everybody's energy as we move on this journey. Yeah.
So in what may be the first time ever, we're going to end this session early. Thank you for your questions. Thank you for your interest. And what we're going to do is we're going to move the break up. So from now till 11 o'clock is going to be the break. And then from 11, we're extending the stakeholder voices session for an extra 15 minutes. So we're going to break now. We're going to go backwards to the right slide. We're not. They're going to help us. So thank you very, very much for your attention, for your interest, for your questions, and we look forward to hearing from you in the Stakeholder Voices sessions.